Hi, welcome to another podcast from Ananta Montessori. Today we have with us Dr. Preethi, who is the founder and chief pediatric dentist at Smiley World Kids Dental Clinic in Hyderabad. So thank you for joining us here. We're very excited to kind of talk to you today, especially with respect to children's oral health. So just to get started, what made you, what was your motivation for being a pediatric dentist and especially working with children at such young age?
So I always love working with children. And second thing is I from when I was a child also always I used to bond with the kids younger to me. So from then I always had a passion. And when I got dentistry, I made it a mind that I wanted pediatric dentistry only. And not only it's about treating the child for their smiles. It's in some way we also play a role, building their personality and building confidence to them, and somehow we shape their future in some way. So that's the reason. Yeah.
So our audience is mainly parents with young children around aged 2 to 5 years.
Correct.
So why is dental hygiene so critical for children at that age?
So usually 2 to 5 years is very critical because that is the time the child starts, having their dietary. They start having their own regular routines for diet, and even brushing routine comes into the play. Some children develop some oral habits. Cavities start forming because the junk gets introduced at that time. So that is the reason 2 to 5 is very critical.
They often say it's they only have baby teeth in that time, so it doesn't matter. How true is that?
Mm. So it is not true, sir. So why? Because milk teeth plays a very important role for the permanent teeth. So if at all the milk teeth, gets a cavity and sometimes they get infected, so the permanent teeth buds will be just forming below in the jaws. So around that age group, the permanent teeth would have been just a small calcified bud over there. So once these get infected, the milk teeth, the permanent teeth gets affected in some way. So that way, permanent teeth also, the milk teeth plays a role in developing the health of the permanent teeth, and also it helps in developing occlusion, good alignment of the permanent teeth. In some way or the other, it plays a very important role.
Thank you very much for clarifying that. Now let's talk about kids' basic oral care at home. When do you start brushing a child's teeth? At what age does it start?
So ideally, the brushing should start as soon as the first teeth erupt. And usually, the first teeth erupts around the age of 6 to 8 months. So usually, that is the time the first we introduce with a silicone finger brush for brushing. Even before that, I would suggest that infants after being fed, always they can use a soft cotton cloth or wet gauze around the finger, and clean the gums. That way, that time itself we are actually introducing oral hygiene. And oral hygiene once introduced, you can always maintain it and you can ensure a cavity free mouth.
But as a parent, I see that children resist brushing.
Correct.
So how do we as parents go about it? Like how do we ensure the children are brushing their teeth effectively, especially at this age when they don't
Correct.
really follow anyone's instructions?
So usually, see, sometimes brushing also becomes like a punishment for the children. So that is the reason we should make sure that brushing is introduced as a daily play. So, parents can brush along with the child. They shouldn't feel that they are the only ones brushing. Maybe they can play some nice favorite songs or some kind of timers they can play. And if we allow the child to choose their own toothbrush, they will be more interested and fascinated. And, every 3 months we can change the toothbrush. So that also kinds of give them motivation to brush, and maybe we should reward them, keep some positive reinforcement for children, so that way it will they'll actually be building more confidence and more encouragement to brushing.
Got it.
Yeah.
Any fun strategies, of how we could maybe, you spoke about it, like
Yes, yes.
any examples you can give us of
So
any fun ways of
usually,
how we make it fun for the
yeah,
children?
you can play some songs, like that time their favorite songs, or maybe some stories. So every day it forms a routine for them. Sometimes, for very small kids like toddlers, you can do in lap to lap brushing also. The child can be put on the mother and father, and they can sit and lap to lap they can brush. Or sometimes a little more grown up, we can brush from behind. And when parents also brush with the child, it becomes a routine. And slowly they will itself inculcate the habit anyway.
Sure, but we've also seen that, especially with brushing, children are excited of the toothpaste because usually they're sweet. So,
Yes.
how much toothpaste is okay?
So actually, according to the latest guidelines, so there is a amount of toothpaste is very important. So for up to 2 years, we generally advise only rice grain, that is just smear over the bristles and use it. And above 2 years, 2 to 6 years, you can use a pea size amount of toothpaste. After that, you can use even the full length of the brush. It doesn't matter. And fluoride based pastes are recommended now according to the latest
Any
guidelines.
particular brands that you certainly recommend for our parents to
So
explore?
any brand, sir, like 1000 ppm fluoride is recommended nowadays. So you can use something like there are brands like Aquafresh Little or Pediflor 1000 ppm fluoride. These are all pediatric toothpaste with 1000 ppm. Otherwise, our regular toothpaste like Colgate, Pepsodent, all this also have 1000 ppm fluoride.
Okay, good
Yes,
to know
yes,
that.
yeah.
So, apart from just brushing your teeth, any other oral care you recommend for children, young toddlers, and little elder children?
Usually, see, brushing is most important. Flossing is also a good habit if they can inculcate dental flossing. But usually, the milk teeth always have spacing in between. So, most of the time, we don't require to floss it. But once it is mixed dentition, it is always better that they develop the habit of flossing also. And generally, we don't recommend mouth rinses, but so there are kids, parents who ask, if there is bad odor in the mouth, they would like to. That time, we do recommend some mouth rinse for children. Yeah.
Now, let's talk more about children's diet.
Okay.
Any particular foods that we have which you think are very harmful for children and should be avoided?
Yeah, definitely. Sugars are like, it is definitely not indicated for children. And according to the guidelines and International Association of Pediatrics, up to 2 years, always they don't recommend sugar at all. Above 2 years, also, there is a particular amount of sugar is just recommended. And most of the time, sticky type food, all these are to be avoided, especially sugared drinks, and all these are definitely not indicated. Yeah.
So, in terms of packaged foods like drinks or other packaged foods, juices and stuff, are they okay or?
No, generally not recommended. Sticky type food, sugary snacks, even packaged drinks. They also cause something like erosion. So the enamel wears off from the margins, and sometimes the children develop sensitivity. That forms an area where the bacteria accumulate, and then the decay starts. So usually we don't even recommend beverages to kids. Better to have fruits, in fact, than having the fruit juices. Yeah.
Sure. And with respect to just other foods, there's a common misconception or a myth. I don't know if it's true or not. You can correct it for us. That jaggery is better than sugar. Is that true?
No, actually, jaggery is equal to sugar. Both are, in fact, going to cause, because any kind of sugars, sucrose, fructose, or lactose, anything can definitely form cavities. So that is the reason even jaggery is equivalent to sugar, actually. Yeah.
Okay. And
Sugar, honey, jaggery, everything same.
and especially for what about children? Usually, a lot of times we do night feeds. Just before sleeping, we give them milk. How does that impact their oral health, especially because they sleep with that all night?
So that is the most important thing. Many parents are not aware. So that's a very good question. This is called early childhood caries. There is something called early childhood caries or nursing bottle decay. That is when the kids are being mother fed or bottle fed at night. Sometimes the child sleeps with the milk in the bottle. So the milk will form something called lactic acid in contact with the teeth. So as you know, there is acidic and basic pH. That is how the pH becomes acidic and the decay starts. So what we recommend parents is that around the age of 1 to 1.5 years, at will feeding or night feeding should reduce and stop abruptly. So they should slowly start reducing the frequency and somehow stop it, or give water after every feed. See, basically the milk is the culprit here. So give water after every feed, or clean the mouth with a soft cotton cloth or wet gauze, which many parents are not aware. So that is why I would always suggest every parent to have the first dental visit when the baby is 6 months old, whether the child has a teeth or no. The first dental visit should be when the baby is 6 months old. After that, every 6 months, if the child is able to, they are able to, we will usually do only education, dental health education, and we will recommend the importance of all this.
Got it. I think that you answered my next question, which is about
Oh,
about the dental visits. When is the first time we should
okay.
visit
Yes.
a pediatric dentist? So now that you clarified that question, that 6 months is the first time that they should
Yes.
come in. What should parents be expecting in these dental visits at 6 months and even after that? What happens during the dental?
So usually, sir, first dental visit at 6 months, many children, many babies wouldn't have had teeth actually. The first teeth comes around 6 to 8 months. Some kids it can come after 1 year also. So basically, at that time, we as pediatric dentists only give dental health education basically for the mother, how to make the jaw clean, or if some parents will be worried that the teeth have not yet come, what should we be doing, doctor? So we do recommend some jaw massage, some exercises for the teeth to come faster, and we will give an idea to them what kind of toothbrush to be used at this stage, or if the first teeth comes, how they can actually start brushing and cleaning. All these things, basically it's more of counseling.
Got it. Another thing with dentists, I think this is not just for children, even for adults. We usually, and including myself, I
Yes.
visit a dentist when I have an issue, when
Yes.
I feel pain, not for preventive care. So, why is this important for children? Like, is this something for children? Is it okay if we just visit the dentist when children feel like there's an issue?
Yes, so always it is better not to visit when the pain or the cavity happens. So it is always, prevention is better than cure. So that is the reason when the first visit happens once in 6 months, every 6 months, if there is a dental checkup done, always we can ensure a cavity free mouth, or and other than cavities also there are many things. Some children have habits like they do thumb sucking. Some children have the habit of mouth breathing. In nowadays, because of the weather, like the allergies are more common, the children have the habit of mouth breathing, and adenoid issues, the tonsil, they are all enlarged. So these things, only a dentist or a pediatrician will be able to actually get it diagnosed. So it will help them eventually for growth as well. So never visit a dentist, never wait to visit a dentist till they have a problem.
How often do you recommend our visits should be? Okay, first visit at 6 months, but then how
Yeah.
often?
6 months,
Every
every
six
six
months.
months,
Every six
we would
months.
recommend. And sometimes the children do have very lot of cavities, like who are at caries risk, we call them. Those who are at high risk, we generally recommend a 3 monthly visits also. Like, till they achieve a stabilized dentition where they're not
Got it.
developing new cavities, we recommend, yeah.
Okay. And now, with respect to just children in India, what are the common health issues, or mainly dental issues, do you
Seen.
commonly see among your the children who come to visit you?
See, most of the time it is cavities actually, but of course there are other issues like malalignment. Sometimes, as I mentioned before, due to mouth breathing habit, sometimes what happens is there will be crowded jaw. Due to the mouth breathing, there will be some kind of crowding in the mouth. They will have a very narrow palate. V-shaped palate it is called. So that is how there is a lot of crowding due to that. So for malalignment, kids do visit us. Otherwise, some children may fall, in schools or whatever. So immediately it is said that, like, if it is a permanent teeth, the golden hour, if the teeth comes out in the golden hour, we can replant it. So it is in the first 45 minutes, if it is replanted, the teeth will actually get, it will be successful, the outcome. So that way, when there is a fall, or when there is a cut, a break in the teeth, fractures, the children visit us. Otherwise, as I told you, the parents are complaining even at 6 years, 7 years, child is doing thumb sucking habit. Due to early weaning in children, the thumb sucking happens. Or when the children are bottle fed, they develop a habit called tongue thrusting. They put the tongue out, and while swallowing, it's not a right swallow. That way also, because of that, the teeth will be forwardly placed. There'll be a gap in between teeth. Sometimes parents do visit us due to tongue tie. There is something called tongue tie. The tongue is not able to be pushed out completely. That is also one of the reasons why parents do visit us if there is any tongue tie. And even some babies who are born with natal teeth, it is called. The teeth born at birth. There is a teeth called natal teeth, it is called. For that also it will be moving or it might be sharp. The mothers have difficulty, in feeding. So that time we, as pediatric dentists, help them in removing them on that. Yeah.
So, with respect to nutritional deficiencies, do any particular nutritional deficiencies impact oral health and dental health?
Definitely. Nutritional deficiencies, when there is any B complex deficiency, you will see that the children keep recurrently getting after ulcers. They'll keep getting ulcers in the mouth, and sometimes some children develop some kind of soreness in the tongue. Sometimes, when there is an iron deficiency anemia, you will see that the children will have a lot of black colored spots on the tongue. They will have a different, like some geographic tongue in the mouth. So all these, definitely nutritional deficiency plays a role. And if there is any calcium or vitamin D deficiency, the new teeth will be coming late. There will be delayed eruption of teeth, or sometimes there can be hypocalcification, like the teeth won't be in the right quality. So there will be some kind of spots in the teeth, white spots or yellow spot, like all that.
So you mentioned that one of the common things that children come to you with is cavities.
Yes.
So how do parents detect this earlier? How can we diagnose cavities earlier and kind of?
Yeah. Yes. So usually we recommend that every parent always lift the lip as soon as after 6 months. Every week, once lift the lip and see if you can see any white spot lesion. If there's any white spot, that is the first sign that enamel is getting weaker. That spot, that time itself, if the child is brought to a pediatric dentist, we immediately do something called a fluoride application. It is nothing but a coating. We apply it on that white spot where the enamel becomes more stronger. That is the starting of decay. Slowly it becomes a yellow spot and then it becomes a hole, that is a cavity. And there are three layers in a tooth: enamel, dentine, and pulp. So the decay starts progressing: enamel, dentine, pulp, and that pulp, when it reaches, is the time most of the parents will know, because the child would have started complaining of pain. So that will be one of the last stages in a tooth. So usually we always advise the white or the yellow spot, immediately bring to the pediatric dentist. Yeah.
Children a lot of times engage in thumb sucking or the parents use pacifiers. How does that impact their
So
especially teeth
usually
formation?
thumb sucking habit up to 3 years, sir, we generally don't intervene, because that is called the oral phase. So most of the time the kids, that is the way of pacification for them. So till 3 years it's fine. Above 3 years, the parents should start intervening the habit. Like they can slowly start using some thumb guard, or some kind of neem oil or some kind of bitter paint. After that, there are some kinds called long sleeves they can use. But usually, if it has to be corrected, it will get corrected in that particular time. But if it goes above 5 years, it starts impacting the occlusion. Like the teeth starts coming forward, upper teeth, lower teeth goes inside, and there will be something called an open bite. So there will be a gap. So when that gap develops, no, then the next issue start, like tongue thrusting. So that time we give something called a habit breaking appliance. So that will be done only in a dental, pediatric dentist will do it. So that will be around the age of 5 years. So usually we would suggest that like till 3 years it is fine, thumb sucking. After that, definitely you have to start intervening.
Now, with children, especially with baby teeth, should parents be worried about teeth alignment and spacing, or it doesn't matter?
So usually like baby teeth means till the age of 6 years, right? So if there are small issues, like there is an issue called cross bite. So when the upper teeth overlaps the lower teeth, sometimes the upper teeth will be inside. That is called a cross bite. So those corrections can be done even in the baby teeth actually. But if it is something like crowding, or the teeth are, there is no gap in between, those things we can still wait, because the jaw grows. We can allow the nature to take its action. But small other occlusion, malocclusions like crossbite and all, we can correct it even in the baby teeth.
Got it. So now I think that brings us to a last part of the podcast.
Okay.
So this is an open-ended question. What is one thing that you wish all parents knew about toddlers' dental hygiene and oral care?
Okay. So, what I would suggest all parents would be that, start early. Like, if there is, don't wait for the problems to happen. Make sure that even the oral hygiene is inculcated from the starting stage only. Like, as I mentioned, the first teeth comes, the mother starts cleaning the mouth. Slowly, as they become a toddler, parents involve in that activity, keep some timer, and they will make sure they have some reminder to visit a pediatric dentist, whether they have a problem or no problem also. Slowly, if that is inculcated, we can make sure that not only for the cavity, it will help in the complete jaw growth, development, good milestones, everything will be in the right direction. So I would always suggest parents to start early. Yeah.
Okay. Top three good dental habits that kids should inculcate from the start.
Dental habits: brush twice a day, 100% twice a day. Second thing, rinse your mouth after any food you take. Like, make sure that the food remnants, like, see, everybody talks about sweets, chocolates, sugars, but even slow eating can cause cavities that many parents are not aware. So children might be pouching food and watching screen. They will keep putting food in the mouth and watching screen for like half an hour, 45 minutes. Even carbohydrates will ferment and form acid. So they will pouch on one side, exactly that side you will see cavities on the sides. So slow eating, make sure they don't watch screen while having food. Make sure they rinse the mouth after every meal and brush twice a day.
So right now we're in a world of social media where information available everywhere. So for parents who would like to learn more about dental hygiene and oral care, what are the right source of information that they should seek out?
Always don't follow social media is what I would suggest. Better to go for the international body guidelines. Like, there are good guidelines given by international, if you take pediatric dentistry, there is guidelines from International Association of Pediatric Dentistry or European Association, EAPD we call it. So these are the bodies will give the right kind of information instead of directly blindly following social media. And also go to your nearest and best pediatric dentist. They will help you the best, I feel.
So in your last decade of experience in the space, what is the best part about your job?
The best part is that I am able to, like, sometimes when I see that small children, like, who are like fearful toddlers, they'll be coming to our clinic and our practice and they'll be completely crying. And it's because they see us very frequently, and we will see that they are turning into such cooperative and wonderful kids. So that really gives a lot of mind satisfaction that, okay, we are doing something. They just come sometimes saying that there is pain, but there won't be pain. So we have seen such kids also who keep coming to our practice just to say hi. So that way, sometimes I feel they are all more rewarding than,
Of course.
yes, that is what.
The most challenging part of your job.
Challenging part of my job would be the behavior management, like, where sometimes some children will be extremely anxious and they will be completely crying. So for that we need a lot of patience and we need a lot of empathy to not only for the children, for the parents also. We need to keep motivating them, because some parents are sometimes very rude with their child also. We have seen that. So that way, that is a little bit of challenge, but we do have lot of modifications nowadays. We have the laughing gas to calm the children down. We also have general anesthesia where we can do all the treatments in one go, or we give a small syrup called oral sedation, where the child will be comfortable, conscious, and they will not be anxious to do short procedures in our seating. So these are there nowadays, so not to worry at all.
My last question of the podcast now. Why go to a pediatric dentist? Why not a regular dentist?
Okay, that is a very good question actually. See, just like you go to a pediatrician for, the child goes to a pediatrician for their medical health, I would always suggest, because after BDS is the first 5 years, the graduation. we do an extra 3-year course only on pediatric dentistry. So it is not just about teeth, no, we also learn about their child psychology. We are able to grade the child. In the first visit we'll be able to understand what kind of child the child belongs to, a negative category or a positive category. So we will be able to do things like tell, show, do, where we explain the child, we model the child by showing another child. We do have techniques like modeling, tell, show, do. These are the things how we do behavior modification. These things I think cannot be done by a general dentist. Of course, the treatments like root canal, extractions, they are simple. But to make the child sit and do it in the right way without giving them a fearful experience is, I think, more important.
Okay.
So that way.
That brings us to the end of our podcast. But any final message that you want to give our parents?
I would always tell them that start early, as I told. Make sure that, from the beginning, if you inculcate good oral habits, it will help them in developing to wonderful human being also, because teeth plays a very important role in building confidence, building smiles. It also gives an attitude towards health. So that way, if we start at home early, it will be giving them a very good future. Yeah.
Thank you, Dr. Preeti, for your
Thank
kind
you.
message. And thank you so much for taking out the time and sharing your valuable insights from your professional journey with our parents. I'm sure this is going to be of value to them as we're all navigating our parenting journey and trying to see what best we can do for our children. Thank you.
Thank you for having me, sir.
Thank you.
Thank you.